This is WFYI News Now. It's July 9th, and I'm Abriana Herron. On today's show, why families in Marion County are seeing steep preschool price hikes. A proposal that aims to extend curfew hours for young people in Indianapolis. And Medicaid cuts and potential reductions to HIV prevention and testing dollars could hit patients living with the disease.
Particularly with my HIV, I don't have the luxury of not having insurance because my meds are like $4,500 a month.
Those stories coming up. But first, we're learning more about the teenagers allegedly involved in the mass shooting in downtown Indianapolis over the holiday weekend. 4 teens have been charged in connection with the fatal shooting near Illinois and Washington streets. 2 juveniles were killed and 5 injured. Charges include illegal firearm possession and resisting arrest. One suspect, 17-year-old Vincent Lanking, is charged as an adult. The others are ages 13, 15, and 16. Marion County Prosecutor Ryan Mears says more charges could follow as the investigation continues. Police say they're trying to determine how the teens obtained the firearms. Families in Marion County are seeing steep preschool price hikes. Reporter Eric Weddle explains why the cost is going up.
Preschool tuition in Marion County is rising. At least 7 public school districts, including Beech Grove and Franklin, are increasing weekly rates by $5 to $60. The Indianapolis Public Schools District, which previously offered universal free pre-K, will now charge up to $150 per week for families who don't qualify for aid. What's the reason for this? The state reduced enrollment from the On My Way pre-K program from more than 6,000 seats to 2,500 seats and also slashed the value of vouchers for families. With federal COVID relief funds gone, officials warn some families may struggle to keep their children in preschool. I'm Eric Weddle.
A proposal that aims to extend curfew hours for young people in Indianapolis was introduced during Monday night's City-County Council meeting. The proposed change prohibits Marion County minors from being in public spaces during certain hours. This proposal comes after a mass shooting in downtown Indianapolis Saturday left 2 teenagers dead and 5 others injured. Mayor Joe Hogsett said in a statement that, quote, "The youth gun violence we experienced in our city this weekend was tragic, unacceptable, and completely preventable," end quote. The curfew for youth between 15 and 17 years old will be between 9 p.m. and 5 a.m. Sunday through Thursday, and between 11 p.m. to 5 a.m. on Friday and Saturday. Curfew hours for minors 15 and younger are 9 p.m. to 5 a.m. every weekday. The proposal was referred to the Council's Public Safety Committee. The public can comment on the proposal during a committee meeting on July 16th. Earlier Monday, Governor Mike Braun issued a statement that praised the work of IMPD, but he also said Hogsett and Prosecutor Ryan Mears must take swift action to address criminal activity in the city. Councilors also gave the final approval for a spring fiscal ordinance that allocates $27 million to various city departments and agencies for roads, snow removal, urban forests, and home repairs. And for our final story today, several cities across the Midwest are considered hotspots for HIV because they have so many new cases. Side Effects Public Media's Ben Thorpe reports public health experts worry proposed federal policy changes will not help and may even unravel some efforts to contain the spread of HIV.
Todd Fuqua sorts through the bottles of medications he uses every day to keep his HIV under control.
Do you want me to talk?
Yeah, what am I looking at here?
So these are my prescription meds.
Fuqua was diagnosed in 2012. HIV used to be a death sentence many years ago, but now it's something patients like Fuqua can manage with medication.
My immune system isn't being kind of eaten away at by the virus. It's still there, but it's so low that it's not really having as much of an impact. And more importantly, I can't transmit the virus to other people through sexual contact.
But Fuqua is worried about the future. He earns a living as a photographer in Indianapolis and relies on Medicaid to access his HIV meds. Now, both Indiana and the federal government are moving forward with Medicaid work requirements. That means people would have to prove that they work, volunteer, or go to school for a certain number of hours in order to receive health insurance. Fuqua should still qualify under these new rules.
Like, I'm not worried about passing the work requirements because I'm working. It just seems like an unnecessary burden, and where there's paperwork requirements, there's always the chance of someone missing something.
And Fuqua's worries are backed by some recent reports. One estimate from the Urban Institute shows that as many as 1 million people in the Midwest could lose their Medicaid coverage due to clerical errors, even if they still qualify. And there's so much at stake, especially for people living with HIV in the U.S. That's because around 40% of them get their health insurance through Medicaid. It's been a lifeline for Fuqua.
Particularly with my HIV, I don't have the luxury of not having insurance because my meds are like $4,500 a month.
Without the medicine suppressing his viral load, he could potentially become infectious, which makes him a risk to any sexual partners. Medicaid changes are not the only concern, though. The most recently proposed Trump budget for 2026 almost completely cuts funding for HIV testing and prevention to the Centers for Disease Control and Prevention. That's especially worrisome in Midwest cities like Indianapolis, where HIV cases have continued to climb.
We have the STD roulette game for engagement and whatnot with patrons that come by and want to get tested or just want.
HIV outreach coordinator Joshua Brown stands at the parking lot of a Walgreens in downtown Indianapolis. He explains the resources at this pop-up HIV testing site.
And lots of little pamphlets, that talk about things like harm reduction and HIV and PrEP.
Brown says he worries that reduced funding will mean less resources for prevention efforts like this mobile clinic, among other things.
There are going to be people that are not going to know their status and are, unfortunately probably going to be HIV positive and put other people at risk potentially for that transmission.
Other Midwest cities like Chicago, Detroit, Cincinnati, and Columbus are also identified as HIV hotspots that gives some of their counties access to special federal funding that started around 6 years ago. That funding is not under threat, but the CDC funds that fuel almost all prevention efforts are. That includes money flowing to local nonprofits. Alan Witchey is the president of the Damien Center, Indiana's largest HIV/AIDS service organization. Their clinic offers things like free testing, affordable prevention medications, housing, and other services. Witchey says many of the nonprofits' funding streams now feel at risk.
In this moment, it's very hard to plan how you're going to serve a group of vulnerable people with high needs when you know there's going to be massive reductions and you already don't have enough resources to serve people.
And the stakes are high for people living with HIV. Here's Todd Fuqua again.
I like to think that it's all going to work out, and I'm fairly optimistic, but it's pretty scary. Again, the combination of the state cuts, the state work requirements, the federal cuts, the federal work requirements, and then all the safety net programs, the threat's real.
Trump's proposals will ultimately have to be taken up and approved by Congress. Whether a final budget includes cuts to HIV testing and prevention remains to be seen. I'm Ben Thorpe, Side Effects Public Media.
That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin and Zach Bundy, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, TikTok, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.